USMLE style question. Ventral posterolateral nucleus, VPL. A 45-year-old woman presents with loss of sensation on the right side of her body. She has difficulty feeling temperature, pain, and touch on the right arm and leg, but proprioception and vibration sense are preserved. The patient reports no weakness or changes in coordination. On neurological examination, she demonstrates reduced sensation in a contralateral distribution of her body, particularly the right hand and right foot. MRI of the brain reveals an ischemic lesion affecting the right thalamus, specifically involving the ventral posterolateral nucleus, VPL. Which of the following functions is most likely impaired in this patient due to the lesion in the ventral posterolateral nucleus? A. Sensory information from the face. B. Motor control of the contralateral arm. C. Sensory information from the body. D. Coordination of fine motor movement. E. Visual processing from the contralateral visual field. Answer: C. Sensory information from the body. Explanation: the ventral posterolateral nucleus of the thalamus is a sensory relay nucleus responsible for transmitting sensory information from the contralateral body, i.e., below the neck, to the somatosensory cortex in the parietal lobe. The VPL specifically receives input from the spinothalamic tract, pain and temperature, and the medial lemniscus, fine touch, vibration, and proprioception, from the body, which it then relays to the somatosensory cortex for processing. A lesion in the VPL can result in contralateral sensory loss on the opposite side of the body, typically affecting pain, temperature, touch, and proprioception while preserving motor function and coordination, because motor functions are processed in other parts of the brain, like the motor cortex and basal ganglia. Why other choices are incorrect? Sensory information from the face, the trigeminal nerve, CNV, and its associated trigeminal nerve nuclei are responsible for sensation in the face. Sensory information from the face is relayed through the ventral posteromedial nucleus, VP, of the thalamus, not the VPL. B. Motor control of the contralateral arm. Motor control is mediated by structures like the primary motor cortex and the basal ganglia. The VPL is not involved in motor control. It is responsible for sensory processing. D. Coordination of fine motor movement. Fine motor coordination is mediated by the cerebellum, basal ganglia, and motor cortex. The VPL does not have a direct role in motor coordination. E. Visual processing from the contralateral visual field. Visual processing is carried out by the lateral geniculate nucleus, LGN, of the thalamus, not the VPL. The LGN processes visual information and sends it to the occipital lobe for interpretation. Clinical relevance. VPL lesions typically present with contralateral sensory deficits involving the body, which may include deficits in pain, temperature, touch, and proprioception, depending on the specific pathways involved. The VPL plays a critical role in relaying information about the body's sensory modalities to the somatosensory cortex, where the information is interpreted. Lesions affecting the thalamus can produce a variety of sensory disturbances depending on which nucleus is involved. For example, VPL lesions affect sensory perception from the body, while VPM lesions would affect sensation from the face. Would you like more questions on thalamus?